Meanwhile, many pediatricians and emergency physicians are now calling for better mental health care for children. They say provider shortages are leading to appointment wait times of over a month in some major U.S. cities. Meanwhile, the American College of Emergency Physicians says mental and behavioral health emergencies in children are on the rise. ABC News medical contributor, Chief Innovation Officer at Boston Children's Hospital, John Brownstein, is here with more on this. Dr. Brownstein, thanks as always for coming on. You know, I've actually heard this anecdotally from a few doctors myself. So why is it so hard to find mental health care for kids right now, even kids in crisis?
Yeah. Well, Diane, this is one of the biggest threats to our pediatric population. And we have spoken about a lot of threats, the triple-demic, for instance. And it's the biggest challenge we're facing at our own hospital. About 500,000 children every year are seeking behavioral health help in emergency departments. And that really isn't the best place for them to be. So we have a resource limitation issue, a shortage of pediatric mental health providers that results in that wait time. We end up seeing these kids going into the emergency departments as entry points, and really those EDs are not equipped to help the kids. And then you see volume that's astronomical. And then we have systematic gaps, limited community and specialty resources, staffing challenges that really accentuate this problem. So the bottom line is our health systems are not there to improve care for our kids in mental health crisis right now.
So what's being done about this? How do you fix it?
Yeah. So we have to figure out where we need to put the resources. We need additional training. We need additional support. We need, of course, capacity. We need to make sure that primary care is the center of gravity. So kids seek that care in primary care, not in the emergency departments, that we have community resources, including mental health mobile vans, that we have the increase in use of telemedicine as a tool, that we plan for discharge, right? Because the challenge is when we put kids back in the home, do they get the help that they need so they don't end up back into the emergency department? And we need better collaboration between our mental health specialists, between our primary care physicians, between the schools, all working together to take care of our kids.
So Dr. Brownstein, what's your advice to parents who feel their kid needs help and are having a hard time finding it?
Well, you know, of course, there are a lot of resources out there. Of course, the schools should be providing some of that resource. Talk to your primary care physician. There are online resources, of course, but try to avoid getting to a point where this becomes an acute problem where you end up in the emergency department, right? You need to see those warning signs first. Talk to your kids, get them the help they need, even if that is through telemedicine where they may have less stigma. So resources out there for those kids before they hit the ED.
All right, ABC News medical contributor, Dr. John Brownstein. Dr. Brownstein, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.